Hello, everyone, and welcome to today's class on tetanus. Today we will be addressing the prevention of tetanus, including its causes and symptoms.
You may have heard of, or have even contracted this silent nerve monster, but today we're going to dive a little deeper than dermis on this topic. So what is tetanus? Tetanus, also known as lockjaw, is a bacterial disease known as Clostridium tetani, or C. tetani for short. This specific bacteria is known for producing toxin-infested spores that can be found everywhere in the environment and are resistant to heat and most antiseptics. The spores can remain dormant for years until they find prime real estate inside the human body. How do you contract it? Tetanus is contracted through wounds or lesions in the skin. The bacteria could come from a rusty nail or from merely touching infected objects and surfaces with open wounds. Once the spores enter the wounds and become active, they release a toxin called tetanospasmin, and this toxin will target the nerves that control muscle movement. Imagine little ninjas entering your body and taking control of your ability to walk, talk, chew, and raise your arms. Crazy, right?
Symptoms. The average time from infection to appearance of symptoms, also known as the incubation period, is 10 days but could range from 3 to 21 days. Symptoms can vary depending on the type of tetanus that has been contracted, and we will be addressing all four in this segment of the video. Generalized tetanus, which is the most common version, starts with a gradual onset that worsens over the span of 2 weeks. Associated issues are muscle rigidity in the jaw, lip tension sometimes producing unwarranted grins and forced smiles, neck spasms, difficulty swallowing, and abdominal pain. Some other offshoot symptoms are high and low blood pressure, excessive sweating, and fevers. Localized tetanus. This uncommon form of tetanus causes muscle spasms near the site of a wound. Don't think you're out of the woods if you've contracted this version. It's usually less severe but can progress to generalized tetanus. Cephalic tetanus. This is a very rare form of tetanus resulting from a head wound. It causes weakened face muscles and jaw spasms. It also can progress to generalized tetanus. Neonatal tetanus. This form of tetanus is contracted at birth from use of unsterile equipment to sever the umbilical cable, or if non-sterile equipment is used to cover the umbilical stump after birth. Symptoms include muscle spasms, which are often preceded by the newborn's inability to breastfeed and excessive crying.
Prevention. Since tetanus has no cure, you heard me right, there is no cure for tetanus. The best way to prevent contraction is by being vaccinated. Very proactive, right? The tetanus vaccine is given to children as part of the diphtheria and tetanus toxoids and acellular pertussis vaccine series, also known as DTaP for short. Children who do not tolerate the pertussis component may receive the alternative vaccine called DT. The DTaP is a series of 5 shots typically given in the arm or thigh to children at ages ranging from 2 months to 6 years. Booster shots known as DAP are recommended between the age groups of 7 to 18 and 19 or older. Boosters are also recommended to mothers during their 3rd trimester of pregnancy, regardless of vaccination schedule, since both themselves and their future newborn are at a higher risk.
In closing, tetanus, or as I like to call it, the nerve assassin, is a very dangerous bacterial infection and can be life-threatening if left untreated, so we must do our best to ensure we get vaccinated and others around us get vaccinated as well. We would like to thank the Mayo Clinic and the World Health Organization for providing all the facts about tetanus that we went over today. I hope that we've all learned a little more about the causes, versions, and symptoms of tetanus. Until next time, my friends.